Orthodontist. I'm the founder of Straight Smile Solutions. You can visit my site at straightsmilesolutions.com. It's an online resource for dentists who want to learn more about orthodontics. And hey, if you're a patient and you have some questions, gladly take a look at the resources on our site. But you can also connect with me if you'd like to know more about different topics or to be referred to a doctor near you who provides some of the resources that you're looking for or different appliances. And if your doctor doesn't have some of the appliances that I talk about and you're interested in them, let me know or let them know to contact me and I'd be glad to teach them. So today we're talking about something a little different, which is sleep apnea or OSA. And this is a new kind of subspecialty in dentistry. It's actually standard of care for all dentists to be diagnosing or at least working with an MD to help diagnose sleep apnea. Dentists can diagnose and treatment plan sleep disorder breathing, which are the associated conditions that occur during growth when a child is growing incorrectly and starts to exhibit some of the symptoms that later the sequelae will become OSA potentially. That makes sense. So things as simple as soft diets, oral habits like thumb sucking, tongue thrusting, incorrect swallow, even just an abnormal bite can eventually cause what we call malocclusion, which is an incorrect bite or incorrect growth of the jaws in the wrong direction or not fully. And this can later cause problems with airway and breathing, or even younger in kids. So luckily in kids, it's treatable. So that's great. Make sure all your kids are getting screened starting at age 2. They should see a doctor who knows something about sleep disordered breathing. Any questions, connect with me. But today we're going to be talking about OSA. And what do we do when we're all grown and oops, our jaws didn't grow correctly, right? For whatever reason. Maybe we waited too long to have orthodontics. Maybe we had oral habits. Who knows what happened? But now we are having problems getting oxygen to our body and tissues, and this is extremely unhealthy. And it's something that it can't be fully corrected, but it can be improved so you have a longer lifespan and a better, living situation. So OSA basically happens when there's a blockage of the airway, when the soft tissue in the back of the throat collapses during sleep. You have these apneic events. The brain slowly arouses and you feel not rested. Your body feels not rested. Nothing is healthy. It's really a very dangerous situation. Untreated can cause high blood pressure, problems with the cardiovascular system, memory problems, weight gain, and all sorts of other things that I can't talk about on the internet. So these are just some of the oral sleep appliances. There are a ton of different systems out there. This is just some that are out there. But basically, in a nutshell, these appliances are made to advance your mandible forward, your lower jaw forward. Now, if your mandible or your lower jaw is behind, or both your jaws are behind where they should be, well, your airway is small. And if your airway is small, you can't get enough air into your body when you sleep. So these all pretty much work the same. Sometimes it's hard to tolerate them and they're not very comfortable. So I really recommend that you get your kiddos screened starting at age 2. I don't care what age your child is, get them screened. And make sure your dentist or your orthodontist understands sleep disordered breathing. Not all dentists and orthodontists are trained in this. So, and even pediatric dentists. So connect with me, I'll find you one who is. But yes, who wants these? These are very expensive. You're gonna go ahead and have to do a lot of testing to get them in a sleep lab most likely. You may have to have a CPAP instead, which is one of those vacuum-like devices that goes on your face. You have to sleep with it. Nobody wants that. So, if you have to have it, you have to have it. But otherwise, connect with me and we'll help to find a solution for your child. Thanks so much.